Welcome to TalentWise, a podcast dedicated to identifying and unpacking challenges and solutions related to the workforce. Each episode, we will hear from experts in their fields or industries who are fighting to better understand shifting dynamics. What are those dynamics, you might ask? Put most simply, the workforce crisis we've seen coming for decades is upon us, and most of us aren't nearly as prepared as we should be. We've hosted expert demographers and researchers who have helped us understand the scale and scope of this very complicated workforce conundrum. And we've heard from industry leaders and human resources professionals tasked with managing strategic efforts to address this problem proactively. Assessing the health of our workforce requires understanding and nurturing our mental health infrastructure because the impacts of mental health and access to mental health care are key issues in the complex and rapidly evolving world of our workforce landscape. That's why I'm so excited to welcome Kim Boswell, Commissioner of the Alabama Department of Mental Health, to TalentWise today. Welcome, Commissioner. How are you?
I'm doing great, Danny. How are you today?
So far, so good on a sunny Thursday.
Right.
For those of you listening, Kim Boswell is a true leader. As I've heard her share publicly and most recently at the PARCA Annual Forum, her own story, mental health is more than a personal challenge facing an individual and their family and friends. It's a community concern, workforce productivity, and our collective future as a state, as a nation, and as a global society. So Commissioner Boswell, thank you again for joining us. We really appreciate it. You know, it's funny, I don't actually remember the circumstances around when we met for the first time, but it was a long time ago. And like I've referenced, I've heard you share your story a lot of times, but for the benefits of those tuning in, how did your life experiences and the decisions you made along your journey bring you to the position that you're in today?
Yeah, so I think it's been about 7 years. But who's counting, right? And so it's been quite a journey. And I sometimes say to people, if you knew the story of the first 18 years of my life, you would probably be more inclined to reserve me a bed at Bryce Hospital than think that I would be the commissioner of the department. But thankfully, God had a very different plan. So like many children in our state, I had some adverse childhood experiences that affected, my future relationships and my educational success as well. However, I really do consider all of those experiences a big really be able to do the things I do every day in the role as Commissioner of the Department of Mental Health. So, with hindsight, I can see how all of those things really prepared me for the role that I'm in today. But, I didn't wake up one day and go, I think I want to be the commissioner of the Department of Mental Health. And so for my family, it really started with my parents getting married between my mother's junior and senior year in high school. And if I remember, Danny, you might have adolescents maybe in your house, youngsters.
I do.
Yeah. So think about how prepared they. And really for her, there was already some bad brain chemistry going on. A year before that, she had been in a car accident. My mom had and sustained a moderate brain injury. And so even going into that, there were some issues just with her brain chemistry that were eventually going to cause some issues later on. And so she gave birth to my brother the November after her senior year in high school. And then at age 20, gave birth to me and suffered a bout of postpartum depression, really before anybody even understood what that was. No one understood. No one really knew how to help her. There really weren't medications during that time. And even if there were, people just didn't really understand what postpartum depression was. And so the good news is, and I'll talk a lot about this throughout our presentation today, relationships and support are so important. And so thankfully, my grandparents really stepped in and helped be the support for my parents. And then as the marriage dissolved, we moved in with my grandparents. And so for me, that was the safe and secure place. And for my little brain development and my brother's brain development, that really was the most important thing at that point that could happen, was for us to be in a place where we felt safe and secure. And we had extended family that lived next door to us. And so, as people often say, it takes a village. There were lots of people around us who really supported us. And as we know, 90% of brain development is done by age 5. And we lived with my grandparents until I was 6 and my brother was 7. And so that really did create this wonderful foundation that we could go back to. We always knew, even though some other things happened along the way, we always knew that there was that safe, secure foundation that we could go back to. And I'll talk a lot about how important those relationships are for people.
Well, your success is such an inspiration before you peel back the onion and get a sense for sort of your life experiences that brought you to this place. You're a wonderful leader and an inspiration. And so in your opinion, how important is it that people with lived experiences of various mental health conditions or circumstances that might contribute to challenging environments, how important is it that people who have these types of experiences be involved in policy planning and sort of the design of mental health services?
You know, I honestly think it's one of the most important things. There are some really crucial reasons why we involve folks with lived experience, why individuals with lived experience work in our programs and in our community mental health centers. And part of it is hearing from them and involving them. It does allow us to tailor our services to actually meet the needs of the people we're serving. We often have a saying called "nothing about us without us." And so we really do try to work towards making sure we're listening to the people that we serve so that we can better be more effective and have more equitable outcomes for people. And while it's true that people often obviously need treatment and may need medication, really, in my mind, sustained recovery and healing really happens when people are in relation to each other. And so people with lived experience are really uniquely qualified to support another individual's recovery. From programs like AA and Al-Anon to the National Alliance of Mentally Ill, all those programs are really designed to support relationship development for people with lived experience. In our agency, we actually certify folks. We call them certified peer specialists. Those individuals are individuals who do have some lived experience. And we right now have 440 certified peer specialists on the substance use side, and we have 180 on the mental health side. So you can kind of see from those numbers, those individuals work in our department. They work in our 19 community mental health centers, in our crisis centers. And there's a quote from Dr. Bruce Perry that I love. It says, "Relationships are the agents of change, and the most powerful therapy is human love." To me, the people with lived experience are our agents of change. Yeah. They're the folks who are out there doing the relationship part of that.
That's very, very helpful and helps us frame and think about pathways to these types of careers for people with those lived experiences. Along that line, how would you describe the state of mental health today, sort of nationally, and where does Alabama rank in your mind relative to those numbers and trends?
Really, nationally, the biggest issue that I see is we really live in a culture. And so we're raising children in an environment that is relationally impoverished and sensory overloaded. So that is obviously an issue. And then we're not really meeting the relational needs of our children or ourselves, and our stress response systems are completely overloaded. We might have been having a little bit of that conversation before we started the podcast.
Yep, we sure did.
My stressor is there's some people over in the state house that are making decisions. Thankfully, the budgets have passed, but those weeks during session tend to be a little more stressful than the average day in mental health. But more than anything else, as I talked about in sharing my story, being able to feel safe with other people, that is really what defines our mental health. So there are some things we can do to support each other's mental health. And you've heard me say this before. We're spending more time doing text and tweets or whatever it is today, or whatever new social media app there is. And we need to connect with each other. And when we're not doing that successfully, we need to find the support and help that we need. But Alabama's kind of come a long way in just a few years. So kind of our state of the state report that we always look at every year is a report. And so in 2024, Alabama ranked 39th in overall mental health. So we're not number one, but we're not number 50. Thank the Lord. And really, in 2023, we were ranked 48th. So in one year, we've gone from 48th to 39th. And so we're doing better for sure. We are going in the right direction. I do feel a lot of hope about just people beginning to really understand the mental health issue, and not just from an awareness standpoint, but from being willing to take action.
Sort of taking a step back, we've read a lot about the shortage of mental health professionals nationally, with a relatively small percentage of healthcare workers broadly who are dedicated to mental health and mental health outcomes. What do you see being done to address the shortage of qualified mental health professionals nationally, and how are we supporting those efforts here in Alabama?
So as you know, working in a space, the dilemma is we're in it, right?
Yeah.
We can't just wait for the pipeline of kids who are going to, college. We're in the middle of a shortage, and at the same time having a mental health crisis like we've never seen before, really coming out of COVID. So a lot of what we've had to do is really sort of pivot and look at who are the trusted advisors that people are talking to about their mental health or the mental health of their child. So, for example, we know that 60% of parents would talk to their doctor about their child's mental health before they would talk to a mental health provider or a guidance counselor. And so one of the programs that we have is a public-private partnership with Children's Hospital in Birmingham, and it's called PATHS, Pediatric Access to Telemental Health Services. And that really has allowed us the opportunity to increase access to care by building the capacity of those primary care providers to identify mild to moderate mental health issues if it's a child in their practice. It also provides them access to a therapist or a child and adolescent psychiatrists. And if you want to talk about a shortage, I mean, a child and adolescent psychiatrist is kind of like a unicorn.
Yeah.
You know, it's hard to find them.
Yeah.
But needless to say, because Children's Hospital is such a phenomenal facility, then what it does is give people access to those highly qualified individuals who are working at Children's Hospital. It originally started with a focus on rural practices. As you know, frankly, we have a lot of counties in Alabama that don't have a single mental health professional. And so it really was designed to do outreach to where those counties who don't even have a mental health professional, families could seek that through that primary care provider and have access to the therapy and psychiatry services. So as of March 2025, we had 122 primary care providers and professionals that were enrolled in the PASS program. And so it really is a way to extend the knowledge and skills of folks who are out there seeing kids already. And then the other initiative that we have that's kind of innovative and out of the box, really, for many adults, the person that they're going to go talk to is their faith leader. Mm-hmm. So oftentimes when people won't talk to anyone else about what's going on with their mental health, they will go see their minister or whoever their faith leader is. And so we initiated a program called Faith-Based Support Services, or actually one of our prevention providers did. And it's a program that basically equips faith leaders with the knowledge and skills that they need to support and empower people to go seek the help that they need. So we're not training them to be therapists, but we are training them that if you see these things, this is, a person who may need substance use treatment, or it's a situation where they may need further mental health treatment. And so it's a great opportunity to help equip faith leaders, because often that's who people are talking to. I'm very fortunate to be in a church here in Montgomery. We had a Faith Meets Mental Health Summit on Saturday. We got really lucky. Our new pastor came after COVID, and he just happened to also be a licensed professional counselor.
Wow.
And so we are very fortunate and have really pushed the conversation about faith and the intersection of faith and mental health and seeking help if you have, particularly a more serious mental health issue. And so we've just had to try and be creative and find the people who are talking to folks and make sure that we've equipped them with the tools that they need.
Well, it sounds like you really found a unicorn in your community. I wish there were more unicorns. We know that we have, especially during the pandemic and after the pandemic, it accelerated a lot of things. Among them, the accelerated adoption of technology and platforms, kinds of healthcare, and how do workforce issues here in Alabama and elsewhere impact preventative and early intervention strategies? Those strategies that promote mental well-being and reduce the incidence of negative outcomes.
Yeah. I do think programs like PASS that I just talked about, where you're really using telehealth to reach out to communities. And it's also a way just to keep that situation from escalating into a more serious mental health crisis. Because a lot of times what we see with pediatricians, there may be a child that's on some kind of medication, but then the medication stops working, and that pediatrician doesn't necessarily know the best course of treatment for that child, and yet the child is not having such serious issues that they need to be readmitted to a hospital. And so one of the other, components of that program is they can do a consult with that child and adolescent psychiatrist, so that if the medication needs to be changed or if there's a better medication, and hopefully prevent that child from maybe potentially avoiding a hospitalization if they weren't able to get access to that. It also provides some training so that those pediatricians are better equipped to identify issues earlier in the process. We do a lot of training with pediatricians on trauma and a lot of other topics that we feel like are conversations they may be wanting to have with parents around mental health. And then, for example, we also have a Connect app that we have that is really a lot of different resources, all the mental health and substance use resources in the community. It originally started out with a focus on opioid overdose and misuse, but it has really expanded to be a pretty comprehensive resource. If you're wondering, where to go to get help, it's an easily accessible app that anybody can download anytime, and it's free. And then, there's some other, for substance use treatment, you have to have a particular assessment called the ASAM to figure out where you are in that process and what level of care you need. And you really can't get to treatment until you've had that assessment. And we've been able to offer that assessment really in almost every single county through telehealth. Obviously, the other thing that's made a huge difference is just the expansion of broadband in our state, right? So a lot of things 7 years ago that we couldn't do, we wanted to do telehealth, but we didn't have broadband, all of those issues. We've just seen a huge expansion in our ability to reach out to communities. There's some discussion about telehealth in school settings and other things. And so I think for us, and people can get access to therapy on their phone very easily now. You don't have to go drive to your local community mental health center in a small town where everybody knows your car. You can make a phone call and receive telemental health services over the phone. So it's really been a pretty big game changer for us. So I feel like there's a lot more. My hope is that we'll see some really creative apps and other things come out of this whole discussion about phone usage and turn some of what right now is a negative maybe into a positive that will improve mental health instead of cause more anxiety and depression. Because I think that's possible. I just think we haven't thought about it that way yet.
You have to think differently about the things we're using. How do you recommend, hearing all of this, there's so many pathways that you and your department have created for people here in Alabama, and a lot of things that you all have done that have been replicated in other states. But if you are that person who is dealing with a mental health issue or crisis, or has someone in their life who is dealing with a mental health crisis, you may not be aware of these pathways. What is your advice to someone to access these services here in Alabama?
So the easiest and simplest is to dial 988. So Alabama, like really every other state in the nation, now has access to easy to remember 3-digit number for a mental health crisis. And it really is a way, if you're having a mental health crisis, that can get you access to our crisis centers that are open 24/7. A mobile crisis team can also And even if it's your family member who you think may be having a substance use issue or maybe having a mental health crisis, as a family member, you can call that number and talk to someone who can help walk you through what the next steps could be, how to connect you. You can absolutely, if you're not in a mental health crisis, call your local community mental health centers. We have 19 centers around the state. And if you're not sure about the number or the name of the mental health center, because sometimes the name is not intuitive, it's like,
Yeah.
You don't necessarily know that's your community mental health center. Then I think the 211 system is, a great option as well, because they are very connected to those community mental health centers. There are also a lot of faith-based counseling centers. So if people are not really sure about, what they might experience, in a therapy session, and are more comfortable with someone who has a faith background, there are lots of counseling centers that operate on a sliding scale. Our community mental health centers are really out there for people who have no ability to. Community mental health centers are really the safety net for those individuals, and that's really what they're there for. And it is a service that is offered without regard for ability to pay.
That's incredible. Well, if someone is out there listening and has an interest potentially in pursuing a career in mental health, recognizing we have a real shortage in Alabama today, it is not unusual. There's a real shortage across the country for mental health practitioners in a lot of different sort of forms and capacities. What steps should those people take to begin that process?
So, I would say if you're considering working in the field, I would either volunteer or do an internship before you get too far along in the career path. You really do have to love this work and have a passion for it, because it can be challenging, and it's not the kind of job you can really do if you don't have a passion for the work. And so I do think it's important for people to figure out and do a little experimenting to see if this is really the thing that you want to do. And a lot of times people find that it is, and they go on to stay in the field for a very long time. The other thing I would say is folks who are in this field really need to do their own work. So you heard me talk at Parka. It's like I feel like I've done therapy forever, and I still do therapy. But particularly for people in this field, it is really, really important for them to do their own work. You can't really give away if your cup is half empty because you have your own issues that you're dealing with, then it's going to make it really challenging. And so I think it's really good for your mental health. I do think from a workforce perspective, it's a challenge for us as an agency to try and help our staff stay mentally well and healthy because of the kind of work we do. We have 3 state hospitals in Tuscaloosa, and we really do want to have a healthy work environment for people. But it's really challenging when you've got folks in that hospital setting who are working 24/7. But we do spend a fair amount of time from a workforce perspective trying to figure out how do we support our staff and make sure that they're as mentally and physically well as they can be.
Put on your own oxygen mask before. You are an inspiration, and I walk away from this conversation as inspired as I have by every prior conversation you and I have ever shared. What makes you feel inspired and motivated to continue to do this work and get up every day? And, we're sitting here talking about it, and it's, we're smiling and we're talking about some serious things, but the realities of the things that we're talking about can be very challenging, to say the least. What makes you keep going and continue to draw inspiration from?
I think listening to the stories of individuals with lived experience who've kind of come through the fire and now they're taking that experience and helping others. We just recently, a couple of weeks ago, had our recovery conference. And we have a couple of people on our staff that if you heard their story of all the things they've been through, it's just amazing to see sort of where they are now and their strong passion for helping other people. Talking to our mental health workers at our state hospitals, I mean, we have some mental health workers that have been there 35, 40 years. I actually have an employee that this coming up this month will be his 50th year of service to the Department of Mental Health. Oh. And they're very inspiring to me because they're in the trenches every single day doing the work. And it really does. That's what gives me hope and inspires me to do whatever I can to improve the system, to try and make their life better, whether it's our employees, whether it's the people we serve. That's the thing that gets me up every day for the most part, yeah.
Well, like I said earlier, you are an inspiration. I am so grateful to you for joining us today. It is always wonderful to be with you and to see you. And I hope that you will join us again on Talent Wise. We can unpack this further. But thank you so very much. And I hope everyone listening at home will tune in again next time. But in the meantime, please do look into the great work that Commissioner Boswell and her team are doing here in Alabama. Thank you so much, Commissioner. Really appreciate it.
Thank you, Danny. Thank you for all your kind words. I really do appreciate it.